As we age, we tend to experience more general aches and pains. But are those just run-of-the-mill or a sign of something serious? It's easy to shrug things off as no big deal, but in honor of Heart Month, one woman shares her story and her message about why we all need to listen to our bodies, particularly women. Michelle Dunaway and Corey Atkins bring us tonight's MedWatch report.
My new motto is, if not now, when? I am jumping at every opportunity I have to take a big bite out of life.
Susan Kotila's enthusiasm for life is infectious, and these days, so is her message.
And I've become a little of an annoying advocate too. Even the ladies at Tom's at the checkout counter, I'm saying, have you had your checkup and watch for these symptoms?
She's so adamant because just last year, she wasn't looking out for herself, despite the warning signs.
I woke up in the middle of the night and I assumed that it was my normal trip to the bathroom. Didn't think that this pressure had caused me to wake up. I just woke up and noticed a pressure.
A few weeks later, she had another incident, then another.
Doing my grocery shopping, actually, ironically, in front of the fresh produce, I'm sure just about to reach for some kale. And all of a sudden, I got this pressure back again. And then I thought, and what is this? I said, why is my jaw hurt? I said, I couldn't possibly have a toothache.
After several weeks, Susan finally said something to her husband.
And he said, you know, why don't you just give your doctor a call? And I did. And from that moment on, I don't know what happened. I went from the kale in the grocery store to waking up and you've had a triple bypass, open heart surgery.
Women tend to be caregivers and taking care of their families. They might deny their symptoms or they might be embarrassed to talk about it. So bringing up that heart disease can affect women just as much as men, and that 1 out of 4 women die of heart disease, and it is the #1 cause of death in women.
Thankfully, Susan was not one of them. She acted before having a heart attack, but doctors said it was just a matter of time. Today, about 10 months later, she's doing what she can to take care of herself in cardiac rehab.
The support system here is wonderful. Not only physically helping you and starting you at the level that you're at and working with you. I mean, it makes you feel so confident.
In between workouts and living her best life, Susan is sure to spread her new message.
Take care of yourself. It's not being sissy. It's not being selfish. You're doing it for your family. So I tell women, listen to your body. If it's unusual, it's unusual.
For MedWatch, I'm Michelle Dunaway.